All right. So with that, getting right into it. First and foremost, these are the things that your movement prep should be, and also some of the things your movement prep should not be. Oftentimes, the great old debate on Instagram is what's better, breathing drills or compression expansion model or load management. And as we've talked about in the past, we believe that it's both. But we do agree with some of the criticisms when it comes to the compression expansion model, especially when it comes to convincing athletes that they feel like they're broken. So what your athletes should be doing during their movement prep, and the goal for the movement prep itself, is number one, allow for parasympathetic nervous system activity. One of the biggest detractors to an athlete's performance on the day of training, and I know that this is the case for me personally, is that I will do 10 check-ins and then respond to some athletes' DMs and then rush over to the gym and just get right into my workout. And I have not really let go of the stress that I have taken on to myself prior to my workout. And I think the first thing to do is that it's very, very important to give yourself some time to decompress and to shift into parasympathetic right before you get into your movement prep strategy, primarily because it's a very, very nice way for you to mentally reset, a very nice way for you to calm down and down regulate. And if there's one big thing that we see value in the breathing drills that we prescribe to athletes, is that it is a parasympathetic driver, in the sense that when you are more relaxed and when you are in a more calmer state or what have you, your mobility could actually improve right from there. But the other value there, in addition to mobility, is mentality. Making sure that you're giving yourself some time to down regulate, making sure you're giving yourself some space between the stressors off the platform as you go into getting some stressors on the platform itself. The second thing is prepare references for upcoming activity and the muscle positions involved. So what we mean by that is you want these warm-ups to reference the squat or the bench or the deadlift or whatever it is that you're training for that day. And you want these warm-up routines to mimic that. So for example, instead of doing, let's say, a Cossack squat, a good option, not to say that Cossack squats are a bad option, but more so to say that if you're trying to warm up for squats, perhaps a front-loaded squat or a plate squat or a Bulgarian split squat or something like that can be very, very helpful with respect to activating the muscles that you're trying to use in the squat itself, and also mimicking good, proper position. Also invoking a sense of confidence and readiness, in the sense that you should be feeling like everything that you're doing in your warm-up is conducive to what you're going to be doing in the gym, and also a feeling that you are ready to go under a barbell and not that like you feel a little bit stiff or that you feel like you haven't warmed up enough or what have you. It should feel like you are ready to proceed over to warming up with just the barbell itself. And then lightly challenge you to warm your core temperature. I think this is the biggest thing that I think a lot of people get wrong when it comes to breathing drills and things like that. Although they are very sometimes, often they are challenging, and oftentimes they do invoke some level of, you're out of breath or you're shorter breath after doing these breathing drills, but you're not necessarily warm. And the basic thing that you should be doing when it comes to your movement prep is ensuring that you are actually increased in core temperature and really making sure that you are feeling a very light sweat and that you are feeling like you are actually elevated in that temperature itself. And we typically suggest that the movement prep itself take about 5 to 10 minutes at most, generally speaking. And this does not account for, let's say, if you're working with a PT and they want you to do additional warm-up drills, or if you feel like you benefit more from a 12 to 13-minute type of warm-up as opposed to 5 minutes. We're definitely not faulting you for that, but just more so that generally speaking, if the athlete is healthy and they're just simply looking to get warmed up, 5 to 10 minutes at most should be the general, at least middle line approach that people should be aiming for. But again, does not necessarily address your injury concerns or what you're working with your PT or what have you. So what it should not be is primarily based in temporary feel-good activity. And so while we'll address this in another slide, foam rolling, static stretching, et cetera, while they have a place in the toolbox itself, it should not be primarily on these particular aspects of your warm-up or of your readiness plan. It should not be overly challenging or complicated. And in addition to that, I'm going to skip closer to instilling a sense of nocebo and dependency. in the sense that if you don't, like, having this thought that if you don't do this very specific exercise every single time you squat, you might injure yourself or you might load a imbalanced pattern or what have you. The breathing drills themselves don't actually solve for making you symmetrical as soon as you do it. It's a time over practice type of situation. And so you want to really make sure that you're assessing the warm-ups that you give to your athletes or the warm-ups that you're giving to yourself, and making sure that there is room for movements that allow for confidence and allow for feelings of resiliency, as opposed to doing these in an effort to avoid breaking yourself because you are so convinced that there are so many different issues at hand in your body that you need to specifically do this, this, and this, and then X thing will happen. What we see oftentimes with injuries is that it has very little to do with like how you warmed up for that day and how you manage things more so over a longer period of time. And so it shouldn't take over 15 minutes. Like, you shouldn't be starting your training session during your warm up itself. And the goal really should be focusing on improvement. And so our main job for all of us as powerlifters is to really focus very heavily on getting stronger, and whatever our movement prep strategy allows for us to do that in a healthy and confident manner, that's really where we're going for, and not necessarily looking for something to degrade our mentality or get some bad feelings about how we feel about ourselves and our capabilities. So going into the warm-up strategy being a spectrum, number one, there really is no way to change the tone or tension of your muscle through static stretching. Typically, as soon as you are done with static stretching, after I believe like 30 seconds to a minute or so, you typically will get back to more of that tonality that your musculature had in the first place. But with that, you don't really gain any style points for just simply telling the athlete what you know and putting an emphasis on what they may not know. So like, instead of like regurgitating like what you have read or what you have studied, it might be a better option to allow your athlete to do these types of things, especially if your athlete has a very large emotional connection to it. And so like, if they just simply enjoy doing like a hamstring stretch, or if they simply enjoy like just foam rolling prior to doing their movement prep strategy or what have you, it has no real negative impact. But the biggest danger or the biggest issue comes into play when it's everything that you're doing, as opposed to one of many different things that you're applying to your warm-up itself. So again, your warm-up or your athlete's warm-up should not necessarily be the point of major contention when it comes to you and your athlete. You want to be able to instill a couple of good or improved things onto their warm-up, but you don't necessarily want to tell them that they're like idiots for stretching or whatever the case is. It's always important for you to coach up and to uplift rather than to coach down and to like use your authority for some random reason. Foam rolling does not necessarily solve chronic pain or anatomical dysfunction, but having said that, right, it can provide good relief, and it can provide a good amount of confidence that you're going to feel better in your actual workout itself. Like, no one's saying that foam rolling can solve major structural issues or what have you, but no one is also saying that foam rolling has zero benefit, right? I mean, there are some people that are saying that, but generally speaking, if I personally spend 2 to 3 minutes foam rolling, and that makes my SI joint feel that much better to get me through that training session right before my deload or what have you, I'm going to do that. And I have done that in the past as someone that has been convinced that foam rolling doesn't really help. If it really makes you feel good for that one session, what is the negative to doing that, right? And so keep in mind that you kind of see where this is going, right? Where like, we have like statements that are true, but also that there is some nuance in those statements, and that there is always a time and place for these applications, just not necessarily something that you want to base your entire movement strategy on. And so lastly, it is not always enough to simply elevate core temperature. And what we mean by that is that while core temperature is one of the most important factors when it comes to your overall warm-up and movement prep strategy, as you get more and more advanced in powerlifting, you're going to need more time to get yourself in good position and for you to work on things that either ail you or work on things that you are working on with the barbell itself. So if you're having trouble keeping your ribs down and you do a goblet squat, it's always going to be easier for you to keep your ribs down and to reference that position during a goblet squat during your warm up. And that sets a nice precedent and reference point for you to apply to your barbell squat itself, just as an example. So keep that in mind. And so in terms of breaking it all down, in terms of what we suggest, what we put an emphasis on here is in terms of time and effort or what have you, the cadence should be start off with something that increases your core temperature and increases your heart rate pretty quickly with a minimal impact to your training. So typically speaking, this could be 100 jumping jacks or riding the Airdyne for 3 minutes. We want this effort to not necessarily be, go do 100 burpees or something like that, but more so an effort that is medium intensity, but low impact to the joints. So you can even do something like 3 rounds of 10 with air squats, lunges, and push-ups, right? Like that will get you a little on the warmer side, but you want something that's relatively non-specific. That's the goal is really just simply to elevate your core temperature and for you to feel better and for you to feel more in that flow state as you get into your training and into deeper into your movement prep. The next thing is really just sensory drills and exercises. So number one, shift yourself into parasympathetic as you are cooling down from everything that you did prior, like the 2 to 3 minutes of the Airdyne or what have you. Take the time to take some deep breaths, think about your training, visualize what it is that you're looking to do, and think about the goals that you have. And most importantly, and I know this is more so in the psychological aspects of things, but especially for lifters like myself who can't get out of their own head, it's really, really important for this time to be, hey, like I'm here to do a job. I'm here to just focus heavily on my lifts, and whatever emails or whatever check-ins or whatever client things I need to do or what have you, that doesn't matter right now because what matters right now is for me to get a good workout and for me to focus on the job at hand. So especially if you're in your head oftentimes, or if you have a lot of athletes that are in their head very, very much, this is a very, very important part to do this, because if they can't let go of what's in their head outside of lifting, it has nothing to do with lifting, but is bringing them down, that in and of itself could not only increase tightness, but it could also affect their performance on the day itself. And then of course, referencing proper positions and bracing, and gaining a sense of muscles that are about to be heavily called upon. We addressed that 2 slides ago, and we'll put a higher emphasis on what we mean by that in future slides when we are coaching you guys through the movements. But addresses common pain responses and causes. So for example, if you are feeling pain in your hip, always a good idea for you to do hip cars or for you to focus on internal or external rotation. You notice that there are different aspects or applications that you can apply to the same issue. It really all depends on what works best for that specific athlete itself. And as you get past the sensory drills and exercises, and after you get done with your warm-up that's non-specific, you then switch into increasing specificity. And that's the moment that you want to get under a barbell. And that's the moment that you want to try to your best to warm up that specific movement itself. And typically when it comes to warm-ups, I will always generally advocate for about 4 to 6 warm-up sets prior to your working set when it comes to your power lifts or what have you, always tapering off in the overall amount of reps that you're doing. So even if I'm doing a set of 6, I will typically do my last warm-up as a set of 1 or 2 reps, primarily because what is most important about increasing your overall warm-ups on the actual specific movement itself is neurological readiness. So you don't necessarily have to do like 3 to 5 reps or what have you of that movement, because that will just simply fatigue you. Just simply doing 1 rep that's a little bit closer to your intended working set will not only save you a lot of energy, but will also just simply prime you just as well with respect to the weight that you're going to jump towards. So if anyone has any questions about that, feel free to hit the chat. So with respect to a good start, first and foremost, the basic goals of your prep should be gaining a sense of your rib cage and pelvis. Like we talked about in the past, we want to see us get a very, very good stack going on. That stack will allow us to keep our spine more neutral And keeping our spine more neutral in the deadlift and in the squat primarily will help us with respect to keeping ourselves in our legs and not necessarily in our lower back and in our hips. Hamstrings and adductors, these are two huge areas that always get utilized, not only in your squat, especially for the adductors, but especially for squats and deadlifts. And so warming up and gaining a sense of activation and a mind muscle connection between your hamstrings and adductors can be incredibly helpful. And also in terms of feeling, getting a sense of your heels and obliques can be very, very helpful here too. These are often the points or often the muscle groups or the muscle functions that some lifters may not necessarily be able to readily emphasize. So for example, if a lifter is like, hey, I can't feel my glutes, it's not that their glutes aren't working, it's just more so that they have to be able to establish a connection between their glutes and how that assists with hip extension. And cueing that, like squeezing an egg between your butt cheeks or holding onto a credit card between your butt cheeks, can be very, very good ways of doing that. But a much more simple way of doing that is getting an athlete into a hip bridge and then having them hold that for 10 to 20 seconds or so. And they should feel not only their glutes, but also their adductors. So oftentimes cueing is helpful, but doing something that encourages that movement or encourages that activation can be very, very helpful, not just for cueing the athlete, but also for adding things into their overall movement prep strategy. In terms of advanced goals of your prep, this should focus on rib cage expansion. This is kind of going into the weeds of the compression expansion model, but rib cage expansion, scapular protraction, and sensing glute med and glute max. This is more so in an effort to not necessarily get generally warm, but more so in an effort for us to solve pain management issues. Not necessarily saying we're diagnosing anything and not necessarily saying that we're solving a medical issue, but typically speaking, a lot of shoulder issues can be solved by a simple rib cage expansion drill. Scapular protraction, similar type of sense, in the sense that oftentimes the reason why scapular protraction is so helpful is primarily because we spend a lot of time in retraction and referencing the other side of that of that movement allows for a restoration of range of motion and can help with respect to pain management, especially when it comes to the upper body movements. And then with glute med and glute max, this is incredibly helpful with respect to knee pain, and also incredibly helpful with respect to using your glutes in the actual squat itself. So with that being said, Brad, what do you got on this?
All right, so yeah, I mean, basically a lot of what we drive around powerlifting is, that was a weird, I don't know, I had like a weird accent just come out there for a second. So what we drive around powerlifting is essentially a rigid torso and everything moves around it, right? That's essentially what it boils down to, and we're just changing the position of the torso. And then again, legs, arms, all that stuff just moves around it. So fundamentally, we need to make sure that we create a solid understanding of what a stack is and understand what the movement is. So a lot of these, so warm-up strategies or movement prep is going to start with something that's specific to the athlete and then build into intensity in terms of getting geared up for a squat, bench, or deadlift, what have you, depending on what the athlete needs. Now, there's a variety of factors that we have to take into consideration for what we select for each athlete, right? So we can all agree a 90-90 is a great way of sensing a stack, but it does nothing for us in terms of strength and controlling that. It's purely to teach, right? It's helping you to find a rhythm for that and be able to take that and go into a training session. Okay, so if you really want to take somebody from somebody like the movement is a spectrum, what that means is that when we are laying on the floor, we are supported by something, or supported by the ground, to be able to do these exercises where we can relax and focus on, you know, creating an isolated position that we're looking for. And then we need to increase that. We need to increase the challenge of that. And that's ultimately what we're talking about with these strategies and you can see, and we're going to go into the next slide here with example, or well, with the first three are basically something that you do on the floor. The next ones you're going to get off, or you're going to stand up and start to use and go against gravity to try to control this. Okay. The first three obviously are PRI breathing drills. The goal of this is meant to either, you know, the first one, goal is to really kind of accentuate stacking. and creating a good pelvis rib cage position and understanding what that feels like and how to get there, and then creating a very small amount of intensity for it. And I'll walk Sean through that. The second part of that is the adductor drawback. That is for somebody that is kind of looking to maybe warm up the hip in a very, very safe and like unchallenged way. Very straightforward. You're basically sliding your knee over the, along the leg, and we'll go through that one too. And then quadruped breathing. Now I'm going to get you slightly off the floor, and I'm going to use gravity as like a reflexive action, right? Everybody, has anyone ever heard of reflexive neuromuscular facilitation, or PNF, or proprioceptive neuromuscular facilitation, PNF? So PNF is essentially a lot of what we see with exercise selection, right? So movement strategy and exercise selection with an athlete is going to be based on competency, what you're trying to do, and you're going to try to make it really straightforward for them. Okay, something that they can be really repeatable and consistent with, right? So if I have if I'm like with the quadruped breathing, if I'm on the floor and I don't want to extend my lower back, but gravity is pulling, when I'm on my hands and knees, pulling my rib cage down to the floor, what do I reflexively do? I keep my rib cage back, right? That's retracting that rib cage, retracting the torso, so to speak, which creates a stack. Okay. So understanding, kind of seeing that from that kind of lens allows you to kind of start to choose which one you need. A contralateral hand position allows you to feel like you can shift into the opposite side, right? To feel stable. Ipsilateral allows me to actually push away from that. Make sense? So, all right, Sean, do you want to go through, let me spotlight you, or pin.
Doing 90-90 first?
Yes, do 90-90 first.
Okay.
So you can do this against the wall or against the bench. If somebody's really struggling with stacking, it's probably a lot easier to do it against, putting your feet on a bench. Right now, we'll go through it with Sean on the wall. Sean, put your feet a little closer together. I don't really typically use a foam roller for this. I pretty much just use feet and knees together. It allows me to kind of sense midline position. And then basically Sean is going to kind of slightly drop his chin and kind of pack his neck and feel his lower back smash into the bench. And then from there, he's going to kind of pull down on the wall with his feet, and his knees are actually going to go up towards the corner of the wall. They're not actually going straight up. They're gently, there you go. Yep. So you see how his knee is pointing towards the corner of his wall or the ceiling there? That's giving him that same position. Now he's got a really strong stack. His upper back is pressing into the pad. His lower back is pressing into the pad, and his tailbone is slightly off the pad. And basically he's just going to breathe here, in through the nose, and he's going to feel expansion in his back. Exhale, and he's going to try to hold his position. Okay. Going to stay away, because ultimately that's going to allow that rib cage to draw down. Inhale into his upper back and chest. Exhale out through the straw, blowing out through the straw. Keep going, keep going, keep going. Pause, tongue to the roof of your mouth. Inhale through your nose. 1, 2, 3, 4. Hold. Exhale. Hold that position. 1, 2, 3, 4, 5, 6, 7. Hold. Inhale again, tongue to the roof of your mouth, into the nose. Good. And you can relax there.
So important to remember that when you're breathing, especially when you're breathing out, you want to breathe out as exhaustively as you can. Like, you should feel your abs lighting up a little bit. You should feel like you're running out of air to a higher degree. And over time, this will get more and more exhausting as you do more reps. So like on the first rep or two, it was pretty easy for me. But then on the third and fourth reps, hamstrings started burning a little bit. And I started to get a little bit more of that elevated core temperature that you might see a response for on these movements.
Yep. So this is so what we're trying to cue here, right, is now if you were to flip your screen, right, and get him into a squat position that he's in right now, right, what we're holding on to is a stack, and he's in a very L-shaped position, right? The reality of it is that's not going to exist when he squats, right? That's going to, and that's going to be purely dependent on his leverages, his strength, his control, his reference of all this. But the big thing here is that when Sean is feeling that into the pad, right? So Sean's sitting down. Sean, can you turn to the side a little bit? Like maybe at the edge of your bench there. Yep. And just, yeah, a little bit more. So sit on the head of the bench there and like, and go side profile. Yeah, that's perfect. Yep. So now let's challenge him a little bit more in what that sense of stacking felt like. Okay. So his feet are very planted on the floor. Sean, I want you to anteriorly tilt your pelvis. Like arch your sacrum up to your head. Yep. So now I want you to drive your sacrum down into the pad and kind of underneath of you. Keep going, keep going, keep going. There you go. Now, right? See how he has now as a flat back. Now, Sean, does that feel relatively similar to what we just had you doing on the bench?
Yep.
Okay. So that sense of it is creating a stack position. Okay. If you really want to dive a little bit deeper into ISAs and things like that, typically a quote unquote narrow ISA is going to feel really good. Like is going to do this almost very naturally. Whereas someone who's more extended, maybe a wider ISA position makes that a little bit more challenging, right? They don't see a little bit more S curve to them because they're more biased into that extension aspect and the internal rotation, if you really want to follow that model. So things like that are great ways to help sense that as he goes through setups of position. Now, if we were to stand him up, Sean, go against the wall for me and about 6 inches off the wall with your feet, flat back on the wall. This is all cueing stacking, right? So now go ahead and do the same thing. Keep your nice and tall, chin slightly tucked, and flatten your lower back into that wall. Now he's feeling his scoop of that tailbone down the wall. He's feeling it compressing towards his heels, and now he has that same position too. Ron, is that about relative position there?
Yeah. So if I go into extension, if I relax my pelvis, I feel nothing. When I pull my pelvis forward and then I drive into my heels, I feel my hamstrings to a very high degree.
Yep.
And so that's a very, very important thing to note. And for anyone that may be wondering, I have a narrower ISA in case anyone's interested in that model.
Yep. So yeah, so it's very natural. Like I said, there's going to be natural tendencies for each lifter, right? You're going to kind of see what you need to cue and what you don't need to cue. Again, the drills here are very straightforward. They're very simple, but they give you a good sense of the more that they do it, they don't even have to breathe with like 90-90. In my opinion, if you really want to kind of get a sense of that and build on it, that's great. But I'll be honest, them sitting there doing like Sean was just doing, sitting down or against the wall or in the 90-90 position are a great way to kind of get that rhythm for stacking and setting themselves up for things like under a barbell. Right. So when he's setting up under a squat rack, he can kind of sense what he's looking for, because you can see from that side profile, he was getting thoracic extension, lumbar flexion, right, and cervical flexion, right? What is a normal S curve? Normal S curve is cervical extension, thoracic flexion, and lumbar extension. Okay. Again, this is all going to be degrees relative to the individual, but that's a great way of kind of sensing stacking. Right. So now if he wants to go into more of a direct approach for like warming up his hips and feeling maybe a side to side reference, Sean, do you want to get on the sideline? Yeah, facing your camera into the adductor pullback. So he's going to put his feet and knees relatively close together. Bring that bottom foot down a little bit towards, so that you're, there you go. Perfect. Bring the top one down a little bit more. I want them right on top of each other. You can lay your inner thighs on each other. There you go. Good. So give me that slight little scoop that we just did. Kind of smash that lower back, keeping that chest nice and a little bit more up so you get that flatter back position. Right now, as he inhales, he's going to drag his right knee along his inner thigh of the left leg and pull it back. Not going to lose contact with that inner thigh. He should feel adductor. He's probably going to cramp a little bit. Okay, and then he's going to exhale and kind of press down with his top knee. Good. Inhale, tongue in the roof of your mouth. Feel that expansion in your back. Keeping that tuck. Slide that right knee back a little bit more if you can. Exhale and press down. Keep that left knee down a little bit. There you go. Yep.
See, I'm trying to cheat the position, right?
So what he's trying to do is get his left to help him push over to that right side. You want to hold that down knee in place. Usually, if you're on a floor, you have more reference with it. Okay. Now, if he really wants to get super like more dynamic and start to feel movement, Sean, go ahead and reach your right knee over your left knee, and then pull back and slide. Keep it along the inner thigh. Good. Now he can do rep work like this.
Yeah, now I feel both left and right adductors working.
Yep. So now he's loosening up the glute max. He's loosening up the glute med from this position. Again, this is supported by a floor. So if we want to challenge this, now we're going to go into that second group of that second group there that we have on the slides. So Sean, stand up for me, and let's go into a split squat. So face the camera for me, like straight on if you can. Yep. So put your feet together first. This is typically how I kind of set up. So soften knees, give me a little bit of that slight tuck, right? Chin slightly packed. Good. Now I want you to take your left foot and slide it in a straight line along his midline. Everybody sees his midline with his inside of his feet. That's his midline. So go ahead and slide that left. Yeah, just slide the left foot back into a split squat position. Don't let it leave the floor. Yep, slide it back, good. A little bit more, and then get into a taller toe position on that back leg. I want that back knee directly underneath your hip so soften that left knee a little bit more for me. There you go. I want that directly underneath him. Now he's basically going to squat straight up and down on that right leg. Go ahead. I know he's limited by space because the bench is behind him. That's fine. So what you're seeing here is you're seeing that adductor work, right? This is more of an adductor hamstring, a little bit more of a loading mechanism, right? Especially if he even rotates his left hip towards his right knee. Yep. And now look at that. That's definitely closing that angle of the pelvis relative to the femur. Now, if he wants to get more glute max, let's say somebody's a little shifty. Let's say they like to shift into the right hip a good bit. Sean, reach your right arm towards the camera and let your right shoulder go with it.
Right arm towards, yep, like that.
Yep. Now, I want you to let your right knee travel over your right big toe and basically try to like move down onto your inside of your foot. Heel stays down. Good.
Yeah, I feel a lot of glute there, and feel
this is a lot of glute max. Now, even when you shift forward, I want you to push back with your inside of your right foot and push back into a start position. So forward, and now push away from the camera. There you go. So,
yeah, a lot of hamstring and glute there.
Yep. So he's getting a lot of now. I bet he feels a little pump in the corner of his glute.
Yeah, like, and for reference, guys, my IR on my right side is total shit. And so just keep in mind that that's why I'm just like wincing a little bit, because this is actually what I should be doing that in my movement prep. That's itself.
So the reason why he feels limited in his IR is because when he was shifting over into that right leg, right, when you're shifting that left leg, that left hip over to the right knee, go ahead and shift it over, like rotate left arm over right knee, left hip over right knee. Yep. That rotation right there, okay, that is creating a closing angle on that hip. He can't IR in that hip anymore because essentially there is no space between his acetabulum, his hip bone, his head of his femur, and his hip. There's no space there. There's no space to internally rotate. He has moved the position over. Sean, I'm going to pin my video. You can relax there. So remove the pin. Can everybody see me okay? Okay. So essentially, right, if this is the shape of his hip, when I take this, because remember, this is the right side, okay? So if I take, this is the, this one. This is the front edge for you, for the camera view here. So I'm facing forward, right hip bone, posterior aspect of the acetabulum, anterior aspect of the acetabulum. When I rotate, okay, you're going to see this action. See how I don't have any room to internally rotate now? I can't rotate over, okay? I can't twist into IR. I've closed that angle down. I can ER all day, right? That's why you see a lot of people start to drop their right foot out in a squat on the right side, okay? That's why you see a left foot tend to slide forward on a squat too. right? Because they're pushing this way and then still staying square.
Yeah, like when I squat the heaviest weights I can, my right foot flares outward. Like you guys can see so essentially what ends up happening here is that I typically squat in a narrow stance with my toes out like so. Typically, when I'm squatting heaviest weights I possibly can, my right foot will flare out like that.
Yep. So that's what you might see more often. That's a very common asymmetrical effort. Again, this is all graded on degrees of how important is it. So generally when we're warming up for like a squat, a bench, or a deadlift, we're gonna think of things as very like a very bilateral approach. If I'm doing something on one side, I should do it on the other. Okay. If you need a little bit, if somebody is very shifty or something like that, I'd probably maybe start to play with loading first. I wouldn't get too crazy with like loading one side versus the other differently. Like for a split squat, Sean could maybe put like a 20-pound dumbbell in his right hand when he's right stance forward, right? So that's ipsilateral. That's going to get him to push away from his right side, which would be glute, right? Glute max. If I want to shift into my left side, I might go with a contralateral with a 20-pound dumbbell. I might even add a little bit of rotation in that left side into the left. Make sense? That's assuming I'm shifting into my right hip. That is typically the baseline. So I don't ever say like do it the opposite way. I personally don't think anyone is actually pushing over to the right side. They're inherently pushing over to the left side that you would have to do it the opposite way. I think it's a lot of times you're going to see it generally typically a slightly right rotation, either like a right shoulder drop or a twist, or the hips look a little funny. Right cut on a squat, right cuts depth a little bit more versus the left. So again, that is a very nuanced thing that you want to try it on yourself, that's fine. But I would play with it before you really start to implement it. Yep. So so let's go back to the content here. So Sean, let's go with the single leg RDL. Are you still up? You want to still do one more demo?
Yeah, no, I'm down. I'm down. So just, I don't know if we defined this beforehand, but what's it called? Contralateral is essentially opposite and ipsilateral is the same side. So just so everyone knows, like, because we don't want to get too confused on that front. So I know I personally suffer when it comes to these types of anatomical definitions or what have you, but we're doing RDL.
Yeah, so let's start with a Campo first. So a Campo deadlift or Campo RDL is essentially a single leg RDL, right? So it's where both feet are on the ground. When you get into more of a generalized RDL or single leg RDL, it's going to look more almost like a Bulgarian split squat to a degree, but with a very high foot. So we'll talk about that. But going into the Campo RDL, which is a single leg RDL variation, which I really, really like for a lot of people, just because it's very straightforward in teaching. So Sean is going to put his feet relatively close together. Sean, let's do your left side since that side is facing the camera. So I want you to basically take your right foot, move your right heel in line with that line on your sock there for me, on the left foot. So right foot forward. Yeah, right heel in line with that left line on your sock there. There you go. Yeah, feet are going to be straight forward together. I want you to bias a little bit more weight back into that left side, into the left foot. Bring your right heel back just a little bit for me. There you go. Perfect. Okay, so soften that left knee, soften the right knee. Now, I want you to put the weight in your right hand, and I want you to take your middle finger of your right hand, and I want you to touch your big toe of your left foot. Beautiful. Feeling that adductor on the left side?
Yep.
Feeling a good glute stretch on the left glute.
Yes.
Right?
If I am being honest in my brace, yes.
Yes. Yep. Go ahead. Come back up. Keep that weight a little bit tighter to your body. I want you to try to basically drag it up and down your inside of your left leg. Yep. Go ahead. Keep that right knee bent for me. That helps you keep that shift. Right knee stays forward. Okay. Come back up. Good. Yep. And just reach. Keep doing that. Bend that right knee a little bit. There you go. Beautiful. Right knee, not left knee. Left knee is good.
So from the front,
Yep, absolutely. So what this is doing is driving internal rotation. If you want to go into the expansion compression model, squat is more of an externally rotated bias. Hinging is more of an internally rotated bias. Okay. So in this regard, we're getting more of an IR position for this left leg. You see the adductor, his hamstring is working. He's controlling hip extension on that left side. And we're also getting a shift by the nature of rotating his right foot forward as well as his right torso. So really a great way to basically warm up the hip for that position, especially if it feels limited in that position. So either one, again, this is going to be dependent on the task for the day. I would say this is a really good one for warming up a hinge in an RDL or an RDL day or a deadlift day. And then at the same time for like more of a squat day, a split squat would be a great option too. Okay, you can do that for both sides. A lot of times it's going to feel really simple for a right side and probably a lot harder for a little bit more of a balancing act on the left side. Big thing is just keeping that weight relatively heavier on the back foot than it is the front foot. Just the back, see how naturally Sean's left knee stays forward. Sean, give me a few more of those. See how it bends a little bit sooner, whereas when he was to the other side, his right knee did not want to bend as much. That's because it's still trying to load that right side. So getting him to hold that left knee a little, see how easy his left knee comes forward, whereas the other side, his right knee did not want to press forward unless we cued him a little bit. So just something to think about too from a cueing standpoint and a practice standpoint. Cool. And then a goblet squat where the heel is elevated is the other one. There we go. Basically, Sean is going to get a slight tuck and basically move his knees forward, and he's going to track down. A lot of times you're going to see lifters struggle with center of mass issues. Sean does a great job here of letting his body, letting his process and his pattern just kind of take over and him managing balance in his foot. What you'll see a lot of times is with lifters, they'll either try to stay too upright or they'll fall over immediately and they lose this sense of control, right? So if we were to sometimes I need to cue athletes to kind of basically feel them control the up and down aspect of a squat. I might put something in front of them. I might have him do it next to his upright in his squat rack there, just so that he doesn't fall forward into it. Okay, that's helping him maintain his stacked position as well as moving up and down in space, because that's what we're trying to do in a squat. Assuming all things are balanced on a squat, whether it's a bar on your back or a plate in front of him, we're still trying to move up and down. That's the whole process of the last week's calls regarding setup and position is center of mass issues, right? Try to get the bar on midfoot, try to get yourself balanced on your foot in a goblet squat and move up and down. Knees break a little bit forward and everything is up and down. And Sean does a great job of controlling his stack, right? That's that stack position we just went through in the 90-90 as well as the other drills we showed you. So now we've gone through understanding stacking to warming up the hips, whether it's a slightly, a body weight or even slightly loaded exercise, and then into a goblet squat or even into starting to take the bar. If somebody needs a little bit more, that is something that is going to be contingent on, what the athlete, needs or finds, works well for them. And you can kind of, break that down from that standpoint. All right, so let's go to the next slide.
So,
sorry, go ahead.
I'll get started. So with with isometrics, the big thing here is not only do you want to reference positions and not only do you want to prepare the body, but isometrics often offer a very, very good way to activate the musculature while also strengthening the tendons of the body itself. Very, very, very helpful to do, especially early on in a campaign when it comes to getting an athlete ready to increase their loads. So in conjunction with breathing exercises, these can be very, very helpful with respect to solving things like knee pain, especially. So a very large part of this, if not all of this, was taken from Jake Tura He has a very, very good book that's an ebook with respect to managing patellar tendonitis and jumper's knee and things like that. And so a general preview here is, generally speaking, in isometrics, 3x5 in terms of sets, 30 to 45 seconds in terms of length of time. And typically, by the time you are done with that set, it should be pretty close to higher intensities. And so we're looking to work between the RPE 8 to 9 range. So isometrics in terms of Bulgarian split squats or split squats, depending on which you want to personally load, like what Brad talked about last slide. Keep in mind the position in which you put yourself in the split squat or Bulgarian split squat can be very, very helpful with not only your isometrics, but also with loading a pattern that you need help with loading. In addition to this, leg extensions are typically my personal favorite to prescribe and to also perform as an athlete myself. This is typically done with a single leg and not a double leg. And essentially I work up to something I can hold for about 30 seconds to an RPE 9 in terms of weight. And then I gently lower it back down. This has been very, very helpful with respect to me combating my left knee pain, in addition to also breathing exercises, getting my adductors strong. And also my left side is so strong now that I now present issues in my right side. And so these problems will change over time. So keep that in mind, because my IR and my pain and all of these issues that I was stemming from were coming from my left side mismanagement. And as I shored that up, it shifts a lot of that onus onto the opposite side that I didn't ever have an issue with. Now, wall sits are very, very good, especially when you're dealing with an athlete that is working with isometrics and is either new or has a minimal strength level or what have you. Wall sits can be very helpful. If you don't, if 2 feet on the ground are easy, then might be helpful for you to remove one leg away. So that way you put more stress on that one side particularly. And in terms of like hamstrings and hip health and encouraging hip extension, isometrics can be very, very helpful in that sense as well. So holding a leg curl hold at around 80 to 90% lockout, and also a glute bridge hold where it drives hip extension itself. And with respect to a glute bridge hold, you can do this with double leg, or if you want an extra challenge, a single leg hold. Typically athletes that present with bad hip extension will typically cramp up or won't be able to perform a very few amount of reps with the actual glute bridge hold itself. I know hip extension oftentimes was an issue for me in the past. And even though my deadlift and squat are what it is, it's more so that if I did like 2 or 3 reps of just hip extension with my single leg, I would cramp up and I'd have that be really, really bad for me. So oftentimes what athletes report when they're trying these exercises out can also be very, very informative in terms of what could potentially be common roots of other issues or things that you may need to work on with your athletes as well. Brad, anything on isometrics?
So yeah, I definitely like isometrics. I think they're a great thing for, from obviously we use them in some of PRI stuff, but at the same time, I think going into specific exercises is a great one too, especially if you're looking to attack certain positions that we feel weaker, we get a little bit more nuanced. Kind of like with Sean's like right hip shift, right? If I really wanted to kind of tackle that, I can give him that right stance split squat and have him reaching over the right side or reaching out towards the, straight ahead and kind of getting that rotation. I can get him down to the bottom and get him to hold there and breathe and really just kind of isometrically tensioning that glute max a bit more to help him push over through that range of motion. Then I can scale that with either load or position in the range of motion, increase range of motion, decrease range of motion, depending on what we need. So definitely like that. From a strength standpoint, as well as a, like it says there in the first slide, reinforcing the strength of the joints, tendinopathies, things like that.
And so these are just basic warm-ups that we would generally prescribe for athletes that have that present these types of issues. One thing that we didn't necessarily go over that we'll go over in the next slide is the quadruped breathing. We'll just drill that a little bit, but Brad, you can go ahead and take a look at this warm up.
Sure. So struggling with extension issues in a squat, extension meaning more extension in the lumbar or anterior tilt of the pelvis than we would like to see, which is probably limiting depth and not feeling great in terms of force production, because too much is not a good thing. Movement assessment shows poor position capability, except for limitation of bilateral hip flexion, right? So if we're looking to squat and looking for control in the squat, we need to make sure that they can control their stack and restore some level of hip flexion into their positions, right? Table assessments are only going to get us so far, but we need to be sure that we have at least the capability, as well as a lot of times the drills that we select help us reinforce the position we're looking for the movement in general. Okay, they're not there to strengthen, they're there to help reference position better. So initially, I'm probably going to go something like a 90-90 hip lift or a hamstring, supine hamstring bridge, which is just a lower version of a 90-90, except I'm just going to put it on like a 4 or 6 inch block. I'm still going to dig my heels to do something to that level to restore some of that posterior, the counter nutation, the slight tuck of the pelvis, and a little bit more of that flattening of that lower back, so it's not staying so shaped in that cupped position. Okay, so from there, I might breathe to kind of help reinforce that position. You also just get that facilitation of the hamstring, facilitation of the position itself. Then I'm going to go to a little bit more of a unilateral strategy. I'm going to bias my weight back with a front foot elevated split squat. Okay. Dr. Pat Davidson had a really good post the other day, or maybe a week ago, where he goes through the transitions of the split squat, right? Front foot elevated means there's less weight on the front foot, which biases our center of mass more back, which helps us bias that slight tuck stacked position. And then from there, strengthening that, going, putting a little bit of weight in the hand and being able to control that front foot elevated split squat like an elevator. Up and down is what he refers to it as. I think the same thing. I just think up and down, making sure that I stay behind reference here, proprioceptive reference, stay behind my knee. Okay. Again, keeping that slight pack neck, feeling that tailbone drive down, kind of like if you're sitting in a chair right now and you feel yourself press your tailbone into your seat. That stacked position. And then I'm going to hold that as I translate my knee forward a little bit and move down. And then from a movement competency standpoint, I'm going to go with the goblet squat, the heels elevated. I might tempo or pause them, or if you're really good with it, just knock out some really good position as I do that. So a lot of times when we see someone with struggling with extension issues, they're going to do funny things with their rib cage to try to create the position they're looking for. So you might see a rib cage shoved forward like this, like protracting it, or they might flex down. You might see a hinging at the TL junction, right? So you might see them flex down to try to squat down lower, which then doesn't come from the hip, doesn't load that hip. Okay. So seeing some of those position changes, and then from there you can strategize on what you're looking to cue or looking to emphasize. But that's a good one for somebody that struggles with that. All right, struggles with the left shoulder pain in the bench press. We've seen this a lot. A lot of times, if you see some asymmetrical action of the hips, you're probably going to see something to the torso to a degree. Again, this is kind of tying into the asymmetrical stuff we talked about earlier in the week. Is it something I'm going to be overly critical of? It just depends. When I hear pain and issues, things like that, I'm immediately going to look at, from a loading standpoint of what we're looking at. Loading meaning what I'm writing in the program, down to, are we seeing some sort of uneven loading in regards to that? Movement assessment shows in limited IR of the shoulder. Typically, we see that on, like, if you're looking again at the model of a right shifted person, you might see a limited internal rotation of the right side versus the left. So what ends up happening is that you're going to see somebody kind of doing this stuff with their shoulders. You're going to see this pressing action here. And it's going to feel like they're kind of always doing this versus feeling that more loaded position of that shoulder blade. So quadruped breathing with palms on the floor, that's emphasizing a stacked position of a rib cage, but at the same time pressing away and getting some expansion into the chest because of gravity. Okay. Again, this might improve the table assessment very quickly, but then from there, I might go to a single arm alternating row, table row. So I'm getting some reciprocating action. So I might get stacked, okay? And then from there, I'm gonna have a weight in one hand. It could be a cable version where I'm going like this, right? And pulling back with my, well, I guess we'll do this way. So I'm gonna be reaching on this side, the weight to my left hand. As I reach forward to my left, my right arm's gonna come back and repeat and rotate. You guys can't see me very well, can you? I'm probably like a very little screen. 10. Like this, weight in my left hand. So I'm gonna pull, reach my right arm, inhale. Notice how I'm staying back. I'm not gonna I'm not gonna overly rotate there. I still wanna try to keep this back position. Exhale. I'm still keeping this chin packed. I feel like I'm staying away from my left hand. Okay. I'm getting that real protraction with a little bit of rotation to the right. Right? Or I can do that on a bench press. I can lay flat like Sean was in the 90-90 position, or put your feet flat on the bench, and I can get into some neutral grip position and pressing. Like that. So those are great ones to get some unilateral loading into the shoulders, depending on what the athlete needs. Again, it's not always a perfect scenario. Again, it comes down to competency. So if somebody's struggling with more of the row action, then maybe the support of the bench press pressing action would be helpful. Okay. I wouldn't go heavy. I'd probably go relatively light. Then from there, I'm going to go to actually the bench pressing motion. I'm going to go to a hook line bench press or feet up bench or feet flat on the bench press to help. Again, going back to what we were just talking about in the unilateral drill, the unilateral exercise, I'm looking to cue that stacked flat back position, right, from lower back all the way up to the back of my head, and to be able to create that rib cage shape that allows for my scapulas to slide on that surface. Remember, they are the rib cage is shaped in a rounded format, right? So that scapula has also got a like cupping to it that needs to shape around the ribs.
Brad, do you want to coach me through that real quick, the hook lying?
Yep, go for it. So basically, he can do it. So I typically put my feet on the bench. Essentially, I drop my chin a little bit, kind of flatten that lower back, and then from there, I'm going to be in a bench press position, and I'm just going to break my elbows down, try to touch the base of my sternum, and then basically pressing through the elbows. If it's not a heavy load and you're warming up, maybe a slight protracted reach, but essentially, I want to keep contact with this back the entire time. So this could be a warm-up strategy or even an exercise that you're training. Okay. So if you're looking to get a little closer to a comp work, then maybe a Larson option. But for right now, I think this is a really good one, especially if they're struggling with feeling that individual loading with being fixed to the bar, and they're struggling with that position relative to ribs and scapula.
And what should you primarily be feeling on the hook line?
So hook line, if I'm going to go with a hook line, I'm not going to go to ultra wide bench press. I'm for an ultra wide position. I'm going to go with something a little bit right kind of into the shoulders area, and basically I'm going to be pressing away. I don't want to see, as I'm lowering down, I don't want to see this, because I'm going to be getting that from the low back. I want to keep that slammed, that low back pressed into the pad, and then expand as I lower down, because that's going to lift that sternum up a little bit. Okay. So if you're diving deeper into the compression and expansion model, you're looking at what the pump handle is doing. But we don't want to lose that with the whole rib cage. We're looking for the expansion of the pump handle as I lower down, and I'm trying to stay back. I'm not trying to this, right? I want to be pressing away, but that's the beauty of what that bench does, is it prevents you from, you can't go with it. It's going to give you an authentic protraction, assuming that you're staying, right? If I have that wall, like you did that drill with you, Sean, if I have that wall against me, I can press into that wall, and you can see that I'm getting that good protraction. See that? See the shape there? See how it sucks into that rib cage. A lot of times when we're bench pressing, we're always like this, right? So restoring that posterior expansion will obviously restore some ER action of the shoulder. If the left side, that's the left side typically. The right side is missing IR, so you'll get some expansion back into that right side because now both sides of that rib cage have a chance to be in that stacked position, which restores that possible like subtle imbalances. Right. So I'm basically giving more reference. Right. That's essentially what this stuff is giving the reference to the lifter.
And so with that being said, guys, that concludes our discussion on warm-ups and movement prep strategies. Before we jump into any questions, the big thing that we're going to be covering going into next week is going to be introduction to programming. So that's going to be when we dive into the intros themselves, and then we kind of flow into several lessons regarding programming as a general base methodology to going into customized programming. So the next couple of lessons will be around the programming aspect for your athletes. So going into the questions themselves, Michael, yes, I do agree, because Michael's question was basically, if you're doing a top set of 8 reps, is it okay to taper it down from like your last warm up to be like 4 reps or so? I would certainly think that's more than fine. Sometimes I would go as aggressive as just doing 1 rep prior to the 8 rep type of situation. But I do also understand that if we're doing like 8 reps or 10 reps or what have you, that's just a different energy system than you're normally doing in typical powerlifting programming. So yeah, like for higher rep or for higher volume sets or what have you, warming up and tapering the warm-ups as opposed to doing like a single or something like that would make a lot more sense. So I definitely agree with that. And as long as it's less tiring, the whole point of it is to just make sure that we're managing our energy to put it primarily in the main movements themselves and not in the warm-ups itself. So it sounds like you have the right idea there.
Yeah, I agree too. I think, and also too, from a standpoint of consistency, the big thing I would say, and I try to emphasize this with when I talk to athletes about warming up. Warming up needs to be as consistent as you would make out of your training, right? So if you're doing the bar for 10 reps, 70 for 8, 120 for 6, 140 for 4, that needs to be a staple. Like at least the first 1, 2, 3 need to be a staple, because ultimately now let's go into a competition. Are you going to do that many reps at a competition? I personally wouldn't. That's a lot. I mean, I would maybe add a warm up, like maybe an extra single to really help me get ready for a competition. But I'd probably go like 6 with the bar, 4 for the 70, 2 to 3 with the 120, and then I'm on the singles. See how I tapered your warm up? Fundamentally, how many reps of 120 would you need to get warmed up? Right. So you can think of it from that standpoint too, as you get even into prep, right? If you're doing this throughout your training in a volume phase or something like that, not a bad way of doing it, getting a little bit of extra work in to kind of like warm up. But at the same time, you're getting a little bit more comfortability to that load, you get a little bit more stimulus. But as you get closer to a competition, you could start to taper that way, or you could taper that in the final 2 weeks, and you might see a little bit of extra juice going into your single, basically, right? Because you could essentially add, if you need to add an extra single or something like that to warm up, why not? Right? You can take, some 20 kilo jumps into your, top set, whatever it may be. I have a warm up calculator that I created a while ago. That if I plug in my top set, it kind of tell me how many warm ups to get there, if that's what I need.
And so Michael's question, I do a lot of goblet squats with, it's Jonathan's question. Going off your point earlier about progressing warm-ups based on competency, when do you feel comfortable taking warm-ups out as lifters may develop dependency and scare themselves into thinking that a problem will come back if warm-up goes out, which is what we don't want. I personally think that you take out a warm up only specifically when you feel like it's lowering the lifter's confidence. But there are warm ups that Brad has given me for my left side that I still do just because it feels good. Not because I think that there's an issue with my left side, but just because I think it's just a routine or habit or what have you. I don't think that I don't think that we would be in the business of taking away warmups as long as it as long as it serves a point, right? And so like if it's specific warmups to me to open up my left IR, that's probably something that we would take away for me personally. But if it's things that will help with respect to generally warming up, like the 90-90 hip lift that doesn't just simply bias into helping out my left IR, that's probably fine to keep in. So I would just more so assess it under the lens of whether it's effective or not. And if it isn't effective in a more general sense, then maybe it might be time for you to shift it over to something that feels a little bit more specific to what that athlete needs.
Yeah, so that's ultimately building confidence into the training, right? Has anyone like you've had like probably like a warm-up protocol where you get under the you've done a couple things or whatever it may be, and you get under the bar and you're like, I'm really ready to go, right? That's the idea of what you're trying to create for each athlete, and that's why it's important for feedback, just as it would from an exercise selection standpoint in programming, right? The movement prep is something that is going to help the athlete feel confident in under the bar. I say this, I say confidence because I think there's a really big divide right now on what warm up means to each individual, and I feel like a lot of people are basically imposing their own beliefs on their own warm up onto other people, and that's fine. I think getting perspective of other people's like understanding of things is great. At the same time, to basically shun somebody else for what they're doing is kind of like me going up and basically saying, so-and-so likes to eat Cinnamon Toast Crunch before they go train versus someone likes to eat oatmeal before they go train. Why like, do I really give a I mean, I'm sorry to be cussing here, but do I really give a shit if they're eating Cinnamon Toast Crunch versus oatmeal? Okay, oatmeal is technically on the, has more micronutrients, more on the healthier side versus Cinnamon Toast Crunch. But is it really making that big of a difference for training? That to me is no different than you saying, okay, I like to do 90-90 for a set or two, but so-and-so likes to basically go straight into a goblet squat. If that's what somebody likes to do and they're proficient at it, versus somebody that might want the 90-90 for a sense of feeling or a sense of hamstrings and a sense of obliques and sense of that stacked position and feel in a slightly challenging position, and that's what they need to feel confident, I'm not going to fault them for it. Just as I'm not going to fault somebody if they want to roll around on a foam roller for a minute or two. So you have to kind of, at the same time when we program for like training, we also have to kind of program for warm up too. If somebody really likes their warm up protocol and I see no qualms with their lift or anything like that, I'm not going to change it. Why? If they like it, they like it. They feel confident getting under the bar. If I can cue it first from a technical proficiency standpoint, cool. I'll do it that way. It's a lot easier for me.
And so, sorry, Brad, go ahead.
I mean, that's essentially just my like philosophies with it. I think, I think social media really makes this like big divide when the reality is that we are all in the middle, right? We all, are doing different things based on the trends we've seen in the last 5-10 years, right? Versus, what social media tells us that we need or can't do. If you want to foam, like I said, if you want to foam roll a little bit, great. If you want to do 90-90, great. If you want to do a split squat, great, right? It's what works for the lifter. Again, that might need some give and take between the coach and the athlete to figure out what that might be. Because there's a lot of things that come into play. There's competency of what we're talking about from a movement standpoint. You could be the world's best PRI specialist, or you could be somebody that really has no idea what PRI is and still have to be able to connect with the athlete for helping them warm up. It depends on the athlete. If somebody's really prone to PRI and they really want those drills and they want to sense that, great. That's what makes them feel confident.
And so with respect to the next question, Kian, and apologies if I'm mispronouncing and please correct me if I'm wrong, but I have a current athlete that I noticed squats with one elbow higher than the other when doing low bar. Both arms are locked in with the bar on his back. However, his right arm is slightly elevated. How would you go about addressing this in the warm up?
Right, slightly elevated. Oh, okay, gotcha. Yeah, probably picture kind of like this. Yeah. I mean, both arms are locked in. How is right? Is it like bad? Is it causing problems? Is it painful? Is it are you seeing any?
So it's not causing any problems, but he's just curious because it just looks like incorrect. But practically his right elbow is just probably 2 or 3 inches higher than his left one.
Let me send my screen. Oh, okay, I'm here.
I don't have a camera, but I would show you if I did. Sorry. Yeah,
This?
just like that. Yeah, exactly.
And the left side's like this.
Yeah.
Okay. Probably something related to just how they are from a rib cage mechanics. You could always benefit from like a rock back breathing. It's kind of like a quadruped, but you're going to be on your elbows, so where you're kind of let me unlock my stuff here. There we go. All right. You see me okay?
Yep.
Right. So getting into a rock back position, I'm gonna come down to the floor. I might go, palms up, palms down, whatever. But basically, you can see I'm trying to keep my collarbone away, kind of like Sean's cue for the deadlift, right? You see how all this stuff connects, right? So I'm still stacking. I'm getting a little bit of tuck, flatten back position. I'm gonna sit back. I'm still keeping that collarbone away. I'm gonna keep that slightly neck packed position, and I'm gonna press away from the floor. And then I can even challenge that. I can maybe go to a pressing action, right? I can go back to the pressing exercise if I'm looking for some scapular mechanics, basically. I don't necessarily think that's too much of a pelvis thing, but I mean, the reality of it is that a lot of these exercises are geared to both pelvis and thorax. So, even if I'm in a pressing action on like a bench press, like, go over here. So if I'm here in this position, right, and I'm flat back pressing, right, I'm tucking that pelvis, right, and I'm going through a motion like this, I'm still getting some pressure into that lower back that is helping me with my pelvis too. So I'm getting both, okay? And I'm getting this rotation. You can see this subtle rotation of my sternum as I'm pressing through that with maybe like some light dumbbells, or if I want to go into a, possibly even to a chest supported row, or even like a cable action again, like this. Okay, so restoring some of that rotational reciprocal action of the thorax and the pelvis and the rib and the scapula could be beneficial for something like that. Again, you also might want to check what their internal and external rotation are laying on the floor to see if that can also kind of clue into what we're looking for too.
Awesome. Thank you.
Yep. Problem.
And so next question, it's a two-parter. So so first and foremost, I hope that everything is okay with your pet. That's always tough. But number one, do you have a general number of warm-up attempts you aim for? Example, 5 warm-ups before a top setter is different based on stuff like lifter, top set weight, etc. So my general answer would be anywhere between 4 to 6 warm-up sets is usually the standard for a lot of my athletes, but you of course increase or decrease based on what the athlete is reporting back to you. And that would be my general answer on that front. And would you ever mimic bad warm-up or suboptimal warm-up to mimic meet day and be prepared for that in case it happens in the event of a small flight or longer warm-ups XYZ? I would say and I probably already know Brad's answer there. I saw his face there, but with the second question, I probably would say that that's more of the responsibility of the coach and the game day handler itself. And if your coach is doing a good job on game day, there really is no real major opportunity for suboptimal warmups because I will go up to lifting cast and stare at it for 20 minutes like a weirdo just to kind of figure out where things are going to break if lifters showed up, things like that. So it's really, really important for game day handling. And we have a whole presentation on game day handling that Brad's gonna lead you guys through. But generally speaking, I would not practice suboptimal meet days situations, because that's more so, not saying it's you particularly, right? But just more so saying that that is at the responsibility of the coach, and making sure that they're on their game on game day itself.
Yeah. General number of warmups, yeah, 4 to 6, I think is perfect. It depends on the lift mainly for me. I'm very, I think I go top at 5 at the most on a deadlift, and that's for somebody that's pulling 270, 250, 260, 270 plus. I might go 5 warmups on a deadlift. You'll never see. I mean, me personally, I never touch a bar in a squat. Just don't like it. Sometimes I don't even mess with the bar at a bench press. I think it's just too damn light. I can get for a squat, I can grab a goblet and get the same effect. I think I've reiterated that before. Yeah, 4 to 6, depending on the individual. If I'm at a competition and they're coming in cold, I definitely probably going to lean more towards 6, especially, if they're, 150 plus on, kilo squat, something like that. Yeah, I don't really have a benchmark. I just kind of go on feel. I also ask the athlete what they like. I'm really straightforward with warm-ups. The example that who put that in there? Was it Michael? Yeah, like that, where he's going like bar red, 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 blue, something like that. I'm really straightforward with. I like that. It just makes backroom warm-ups at game day really simple, right? Because you're not chasing around 1 1/4 chips or having to hold them and loading all these things on, that kind of stuff. But at the same time, it's kind of reiterating, it's tapering the number as you get heavier, taking the appropriate jumps, right? If we think of game day as like, let's say we're working to a top single, it's 100%, right? Let's just assume it's at 9 or 10 or whatever, it's about 100%. So my last warm up is going to be about 4 to 5% less than that. Then I'm another probably 5 to 6% after that. Then I'm maybe taking 10% or a little bit more from those numbers, and I'm working backwards. Okay. That's how I pick game day numbers, and we'll talk about that stuff. But yeah, 4 to 6 for each lift, depending on the individual and also what they like. Now, the second question regarding the meat stuff, I'm not going to be too specific. I'm going to ask the athlete, how do you like to warm up? And then I'm going to start warming up on game day, depending on what they like. If somebody likes a faster warm up, I might start them a little bit later in terms of setting up warm ups. If somebody likes to be slow, I'll start them up a little bit later or earlier. Deadlift is my one where I don't really like to push somebody fast, just because at game day you're already tired. You're already starting to feel the adrenaline, up and down waves of adrenaline, the intensity, the impact from each, from squat and bench. I'm going to probably keep them a little bit on the slower side, and I'm only going to do 4 or 5 levels, and they're all singles typically. Yeah. Just because at that point you're conserving energy at that point, because you need, if you're in a big meet, you're looking to save that final pull for whatever they need to win, or jockey position, things like that.
And you're peaked, and you are literally in the best possible position for you to perform at that point in time. So like, trust your peak, trust your process. So next question is, I have tempo belt squats. Would that be a good movement pattern to gain sense of rib cage and pelvis stacking and the abductor rotation in the descent of the squat? I mean, it really depends on like where that belt squat is loaded. Because oftentimes like belt squat can throw you into extension. Not to say that belt squats are bad, right? I'm not saying that, but what I am saying is that, to your specific question, if it's to keep a sense of your stack, probably not the best thing to do, primarily because it loads your middle back, and it will actually fight your stack to a very, very high degree. I would probably even garner to say that a hack squat would be better than a belt squat, because at least you have a pad that you can reference against from a lower back perspective. And hack squat, even a pendulum squat, I think we have that. So yeah, things like that would probably be better. I think more so that a belt squat is great for volume, that doesn't necessarily axially load. But generally speaking, I think that there are some gains that you can get from a belt squat, but not necessarily from a technique standpoint.
Yeah, And to follow up on that too, a belt squat, right, is when you're loading it significantly, right? This comes back to a lot of things are relatively PNF or reflexive neuromuscular training related, where it's based on the loading and what's going on versus what we do to respond to that, right? So with a belt squat, right, where I'm typically going to be pulling down at a lower angle, right? And this thing is going to want to pull me here. So this is what you see a lot of lifters doing is the start of lift, and then as they come down, you're going to see them start to press their lower back and get that really like deep depth. But then you see this big swinging of the pelvis, okay? So for me, a belt squat needs to be a lot more controlled, in which case, if I'm looking specifically for loading something like a belt squat, I might go to some, it's not a bad option, right? Again, like Sean said, it's going to be really challenging to control your stack, especially at the top. We don't want that rib cage to shove forward all the time, because you're looking for that hip extension control all the way to lockout. Okay. So I might go with something like a Bulgarian. If I'm looking for more glute dominant exercises, I might go to like a Bulgarian. I might go to like a single leg press. To me, that's a very similar action, similar loading profile. If I'm looking for more quad, pendulum hack squat, because I also have the reference of the pad, right, to now keep my back smashed into it and be able to go through that range of motion. And then I can play with, feet height on the platform or heel elevation.
And Mark asked, regarding warm-up sets and training, will you include the ascending sets on the 4 to 6 warm-up sets, or will it be 4 to 6 warm-up sets before the ascending? That includes it in my personal purview. It should be 4 to 6 sets total, not 4 to 6 sets and then 1 or 2 more, just 4 to 6 sets total. And that includes the barbell, also includes the last rep itself.
Yeah, 4 to 6. I reference 4 to 6 from a competition standpoint. So 4 to 6 before the 3 lifts, the 3 singles. But yes, agree with Sean. 4 to 6 into your ascending work.
And so with that being said, guys, that wraps up our Thursday session. So we will be meeting again next week on both Tuesday and Thursday. So just a quick reminder, Tuesday it's going to be 12 p.m. Eastern Standard. Thursday will be 2 p.m. Eastern Standard. And we will have these uploaded within 24 hours moving forward for those who cannot make the live session. So with that all being said, guys, thank you so much for coming. We'll talk to you all soon and see you all on Tuesday.
See you.
Thanks, guys.